And you can start if you'd like.
Okay, thank you, everybody. So first, I just want to introduce myself. My name is Ann Corman. I'm the county legislator for the towns of Ulysses, village of Trumansburg, and also portions of the town of Enfield and Ithaca. And first off, I just want to acknowledge that Tompkins County, which is folks like you, have really done an amazing job of staying home and stopping to slow the spread of the virus. We have only had a total of 165 positive cases in the county, which is amazing. And right now we are in a position where many parts of the community that we love are starting to open up, and people are able to go out and experience more of the community. I've seen this all over the place. I haven't been tons of places, but wherever I've been, I've seen a lot of people out. And we need to make sure that we don't forget that we are still working to stop the spread of COVID-19. So we want to make sure we don't take this for granted, the progress that we've made. And we especially don't want to forget the people who have worked very hard, people such as essential workers, essential service providers, who from the very beginning kept us safe and kept up the important services throughout this crisis. Last week, the county legislature passed a resolution celebrating LGBTQ plus Pride Month. And this year, again, the county is flying pride flags at all of our county buildings for the entire month of June. And throughout the month of Pride, I want to encourage everybody who is celebrating our LGBTQ plus rights and Pride to do so very safely. If you are out in public, please wear a mask and practice physical distancing to help spread the any COVID-19. And I also want to mention, since today is June 12th, which is the 4th anniversary of the Pulse nightclub massacre. It was a gay nightclub down in Orlando, Florida, where 50 people were killed. So today's the 4th year anniversary. So I just want to acknowledge that. So in addition to that, I want to just say, as chair of our County Workforce Diversity and Inclusion Committee, I want to acknowledge and support the many protests and rallies that are going on in our community and around the world, actually, in response to racial injustice. And we embrace the groundswell of support for overdue, positive, and substantial change. We know that Tompkins County, through the legislature and also through the county administration organization, is very committed to addressing systemic racism as an employer and as a service provider. I encourage you to tune into our legislative meeting next Tuesday for more details, and that's at 5:30. Next, I'd like to invite our county administrator, Jason Molino, to give updates from the county and on community reopening.
Thank you, Ann. I appreciate you joining us, and appreciate the opportunity again to speak with the public and the community. Before I get into any updates about COVID, I'd like to just share some more details about what the county's planning with respect to addressing structural racism and how we continue to improve our organization as well as an employer and a service provider. I've asked department heads to address this crisis head on, and we'll be supporting our departments through resources as we start to make some changes moving forward. I'll be bringing forward an agenda for addressing racial inequities in our organization to the legislature this Tuesday, as you mentioned, and we'll continue to build upon the work of our internal teams, such as the WDIC committee, which you chair, as well as some internal teams that we've had around diversity, inclusion, and infusion. We're going to continue to build upon the organization and also continue to build an organization where community members feel supported and welcomed, as well as our staff are culturally competent and reflect the community. These are uncomfortable conversations at times, and we strive to continue to build and to learn together as an organization, as colleagues, and as community members. And that's a commitment we've had and will continue to make as we move forward. Regarding COVID-19, phase 3 is reopened today for us in the Southern Tier region. Indoor activities such as restaurants, bars can resume with certain restrictions, as can personal services such as tattooing, piercing facilities, massage, therapy, spas, cosmetology, nails, tanning salons. A lot of this guidance has been posted on the New York Forward website. So it's important that as we open up to kind of second what you just mentioned, that everyone acts safely and that they continue to practice personal responsibility with respect to others as well as themselves. This has been, I think, one of the most important themes when we talk about reopening. We've talked about it a lot, both with the legislature and amongst ourselves and in the community, that personal responsibility is really the first level, I think, of compliance and enforcement. It's everyone taking the understanding that my mask protects you and your mask protects me, and that I'm going to take that personal responsibility. I'm not going to come to work if I'm not feeling well, those types of things, and that we have respectful conversations with each other if there are circumstances where people are not complying or creating unsafe environments. So just want to continue to push the personal responsibility and congratulating the community on a job well done. Before we move on to some questions, I do want to introduce everyone that we have with us. We have Amy Hendricks, Deputy County Administrator and our EOC Commander here down at the Emergency Operations Center. Frank Krupa, our Public Health Director and our Commissioner of Mental Health. And everyone's favorite department head, our Assessment Director, Jay Franklin. Jay is also serving as a Planning Chief here at the EOC. He and a bunch of other staff have been reassigned to planning functions, done a great job. So, Ann, I'll pass it back to you. We got some good questions here, and ready when you are.
Thank you, Jason. Amy, I'm going to start with you. Could you please give us an update on the operations of the Emergency Operations Center?
Sure. So here at the EOC, we continue to get in information and respond to it accordingly. As we move through phases, we start to think about how that reopening will work and what ways we can support the community as they approach that reopening. I know that we are continuing to monitor the dashboard, and I think Frank will talk a little bit about that dashboard at some point. That has shifted a little, so we continue to look at the different metrics to ensure that as we reopen, we are continuing to keep our community safe. As Jason said, our community has done a really great job, and so we want to make sure that we continue that job. So here at the EOC, we continue to think about external services and how we can support them, as well as our own internal operations, and ensuring that we are providing all of the county services that we have been providing and looking at ways to enhance those services. So it still shifts day to day and moment to moment. I don't think things have ever slowed down. Every day seems like a marathon in more and more ways because there are a lot of things happening. And I do have a great team here and remotely that continue to work on all of the different pieces, from pushing out communications to ensuring that we have plans and processes in place to support our community.
Thank you, Amy. Jay, I have a question for you. When will county operations reopen, and what county departments are we still waiting on reopening?
Thanks, Annie. Most county offices haven't shut down. They may have been providing their services in a different manner, and they may have their front doors locked. But places such as our Department of Social Services, Mental Health, our Sheriff, Office of Employment and Training, they've all been open and operating pretty much full steam during our response to COVID. As we start moving forward, a lot of our departments now are requiring people to schedule appointments to come on in so that we can maintain that social distancing within our office space. But I would highly recommend anyone that's looking to come into a county office to be able to go to that department's webpage at tompkinscountyny.gov and be able to look at what services are being provided, how they're being provided. A lot of departments have put in drop boxes outside to where you don't even need to make that contact in order to get what you need done. But as we move forward with this and move on to the next phases, more of that time will be available for the public to come on in and continue to see the friendly faces that we have.
Thank you. And on to you, Frank. can you tell us, has any of our guidance shifted on what people need to do to stay safe and stop the spread? And what is our current guidance?
Thanks, Ann. Yeah, we're still asking folks to do most of the same things, that social distancing, maintaining 6-foot separation, wearing a mask when out in public and when 6 feet can't be maintained, good hygiene, washing their hands whenever possible, and limiting density, keeping the numbers of groups down. So much of the guidance is still the same at its foundation. And then obviously as we begin to reopen, there's more and more opportunity, as you described in your opening, to go out and do the things that we love to do. And we just want folks to be mindful of those key things as they start to engage and protect themselves and the people around them.
Thank you, Frank. And now I'm going to pass it over to Amy, who has some more questions for folks.
Helps if I unmute. You would think I would learn that by now. Thank you, Annie, for all of those questions and kicking us off. Let's go ahead and, there goes the lights. Frank, can you talk a little bit about the new COVID-19 dashboard from the state and what's included in that?
Sure, Amy. For those that have been following the governor's dashboard, we started with those 7 key measures that were in place to determine reopening and then movement through phases. And then more recently, a little bit more detail was added to those. So some of the numbers that were in that initial dashboard are now kind of check marks that you've either achieved or haven't. And there's a kind of sub chart that talks a little bit more detail with numbers. So the idea of number of testing that's happening has become a priority for the governor. If you've heard him speak in the last week or so, many of those measures that were in the original dashboard were kind of lagging measures. So it would take a little while, namely hospitalizations, right? It would take disease to increase in our community before we would see hospitalizations. And so really trying to get more upstream and look at incidents of COVID-19 as well as testing that's occurring. So there's a bit more data in there, and it's a bit more upstream so that we have kind of an early warning system if there's anything changing with COVID-19 in our community.
All right, thank you, Frank. Another question for you. Where can we find out about day camps and when they're going to be open?
So our youth department has been working, and there is a website, I believe, that has information about what we know of camps that are opening. I know a lot of them are rapidly trying to put plans in place in preparation for the end of the month when they're ready to operate. And I know that's of great interest for parents and families in our community. So I'm sure we'll put a link up in the comment section, and that can also be found at our county youth department.
Great, thank you, Frank. As far as parents, are the playgrounds now open?
So the governor did announce that playgrounds can reopen. It is left to local discretion, and we are certainly supportive of that. Our environmental health division is rapidly looking at any guidance that might come from the state and communicating with the operators of those facilities. But I do expect that we will start to see our playgrounds opening up in the coming days.
And along with recreation, our pools. What is the guidance for pools, and are they available, and are they safe to be opened?
Yeah, same situation. Pools are now able to be open, obviously at the discretion of the operator. Those public swimming pools are permitted by our environmental health division at the health department, and so they have been, again, reviewing the guidance that's come from the Department of Health and communicating with those pool operators to help them move towards opening if that's what they choose to do.
All right, Frank, you're still up. I've got a bunch of questions for you tonight. The other piece on this is, as kids start coming out and being around other people, what should parents be sharing with their kids about hygiene, and what guidance is important to young people to follow? A lot of young people can't use face coverings, so if you could talk a little bit about that.
Yeah, really good questions. it's good to have conversations with your children about what's going on, so they understand kind of the reasons why we're asking them to do things differently. So, talk to them about COVID-19 and that, we're wanting to keep everybody healthy, and that's why we're asking them to do these things differently. But focusing on good hand washing is really important for young children. It's important outside of COVID-19, but even more so now. So demonstrating and, exhibiting and showing them the good behavior by washing your hands often yourself, teaching them to, sing the happy birthday song a couple of times, or find a song that they like to sing and figure out how much of it they need for 20 seconds. The hand washing is really, really important. And then, keeping distance. Kids are want to hug and be close. And so, talking to them about how we can wave from a distance and talk to our friends and even make games out of it, trying to give them opportunities to play and be with each other, but doing it in a manner that keeps that distance for them.
All right, thank you, Frank. One follow-up question, not related to children, but talking a little bit more about the information we're sharing about positive cases, and why we have chosen to share the information that we have chosen. And, I think this has been a very thoughtful process. So if you could explain a little bit about the information we're sharing on positives.
Yeah, we get a lot of questions about that. And just to be clear, the number of cases that we share on our website are unique individuals. So whether someone's been tested 4 times and has tested positive, which is not uncommon, as they're evolving through the disease, they're still counted once. And so that 165 number that Ann referenced is individuals here in our community. The other information that we share around testing numbers, much of it comes from Cuyahoga Health Systems because they're doing the bulk of it. That data we're providing because we know the community wants it. But it is important to know that there's a lot of testing going on, and there's a lot of different reasons that impact whether a sample was collected and then it returns into a result, right? Something could have happened with the collection mechanism, that the sample was unviable, something happens in transport, a lab issue. There's a lot of different things that could prevent a sample from turning into a result. And so when you're tracking the numbers that we're providing, it can cause some discrepancies, and folks want it to line up one for one, and it doesn't always do that. So just folks to be mindful of that. And then finally, the demographic information I know is a big one that we always get. We did share when we had, I think, 133 cases, some of the demographics. Likely when we have more cases so that we can protect privacy, we'll do that again. But fortunately, since we were at 133 over a month ago, we're only at 165 now, so we haven't had a huge increase in cases, which is really good news. And then we're also looking at that testing data, because we do get a lot of questions about what's the demographics of the people that got tested. And we are working with Cuyahoga Health Systems to crunch that information and present it in a manner that will be informational and useful to the community.
All right, thank you, Frank. I'll take you off the hot seat for a minute and turn to Jason. Jason, as we reopen, can we rely on the fact that an employer will have required the health assessment? And for an example, a technician comes in to perform a maintenance on an HVAC system in our space. Should the business that's invited in this technician, should they be screening that person, or should they assume that everyone is screening their employees?
Every employer is required to screen their employees. That's the first thing that should be known. As anybody that is participating in reopening has attested that they, as an employer, have screened their employees on a daily basis. Can you screen as an employer? Can you screen other folks that are coming into your business? You can refuse service to them if they're not wearing a mask, if that's something you want to consider. Can you ask them the 3 questions regardless? You can. There's nothing prohibits you from doing it. But I think what's the most important to think about is that all employers are required to screen all employees at the beginning of each day. And this again falls back on personal responsibility and is required to under the reopening plan. So I think that's about the best advice I can give to folks. And if you don't feel comfortable with a certain service provider coming into your space, then you can obviously not hire them and hire someone else. I would probably give the advice to folks that you can ask those questions prior to hiring a service provider. You can ask them as you're inquiring different companies, different firms, ask them what type of screening are you doing on a daily basis? How are you ensuring that you are going to ensure my safety if I let your employees to come in my space? And that's probably, that's probably a good thing to ask, as whether you're a homeowner or whether you're a business owner and you're working with another business and employing them to do services for you, is ask them, what steps are you taking to ensure the safety of me, my family, and or my employees?
All right. Jason, you just hit on a point of a question that we did have come in, asking, are customers required to wear masks in stores, or is that up to the store to decide whether or not they need to enforce it?
So I'm going to lean a little bit on Frank in this, but I'm fairly certain that if a 6-foot distance cannot be maintained, they are required to wear a mask. And it is up to the the business owner to ensure that both employees and patrons are wearing face masks if that 6-foot distance cannot be maintained. So it is the business's responsibility to enforce that. And they have been given the authority to refuse service to patrons if they do not comply with that. Is that correct, Frank?
That's correct.
All right.
Thanks, Frank. Jay, I'm going to turn to you. You've dealt a lot with our own screening processes. And the question is, can a person incorporate a screening process for potential new employees using a thermometer? And how would they do that?
Well, I think that's something that you could do, but unless that potential new employee would start that day, I don't really know what the viability of that test would be. Your fever tells you how you're feeling that point of time based upon your normal body temperature and the accuracy of the thermometer. So it may be something you want to put off until you hire that employee, and then be able to start asking them the questions on if they've been in contact, have they had a recent onset of fever, and then if you are going to take their temperature, make sure you do it on a consistent basis with the same thermometer so that you can take into account a person's baseline body temperature to see if they do have a fever or not.
All right. Thank you, Jay. Jason, back to you. How are things going with phase 2? And are we getting any feedback from businesses related to consumer confidence and how they've been able, and this part actually may be a little for Frank, about businesses accommodating to the necessary changes, and are they following the guidance? So part 1, how are things going with phase 2, Jason? And then part 2, are they following the guidance, to Frank?
So far, I think phase 2 is going, I would say, as best as can be expected. And I say that because guidance and direction came very, very late in the process. I think a lot of people felt rushed. I will say that a lot of businesses have done an extraordinary job taking their time, being patient, putting together good plans, asking good questions, and have been very, very prudent and strategic in their process. And that's reassuring. We also have a poster, a checklist that kind of anybody that has attested that they've completed the attestation and reopening plan that the state requires, they can post in their business. I think we've had over 400 or 500 folks download that. So I think phase 2 is going well. We've monitored the metrics. We have not seen a large or even huge influx in positive cases or hospitalizations over the past 2 weeks. And today would mark the 2-week mark since phase 2 has been open. So all in all, it's been receptive. I think a lot of people, just naturally want to reopen, but I feel like a lot of folks are really taking it seriously, and they're moving into this at a slow pace, and taking the right precautions to do so.
Okay. Frank, on the second side of that question, have businesses been able to accommodate the necessary changes, and is it working?
Yes, I think so. Just as Jason alluded to, they're taking it seriously. I think our community has taken this seriously from the beginning, and our disease incidence reflects that. And they continue to. Our businesses are doing their best. And as an individual, going back to Jason's point about personal responsibility, if you see a business not doing something that, or doing something that doesn't seem right, you have the choice to not frequent that business. And I think, those businesses recognize that part of the expectation from their clientele is going to be to have a safe place to come to. And so I think they're doing that. And I appreciate and thank them for taking those extra efforts.
All right. Thank you, Frank. Jason, what does closing of Aurora Street for outdoor dining look like? What does that mean?
So closing of the street, Aurora Street, I just want to commend the city, I think, for really trying to provide a good environment, a safe environment for those restaurants along that street, which are some great restaurants. I have to add, it'll be good to see them open, to being able to function in an outdoor environment. So how it looks like, essentially each business that had a liquor license had to basically had to draw out a diagram of their spacing and their seating in the outdoor space, work with the local municipality. So the city of Ithaca isn't the only one that has been able to open up right-of-ways for local businesses to take advantage of, and then submit that diagram to the State Liquor Authority for review and authorization to ensure that they were creating proper distancing and spacing while taking advantage of expanded right-of-ways, essentially. So I have not actually seen all the diagrams or seen any diagrams of individual businesses yet, but the opportunity is there, and I think it's a great little segue into the phased opening, particularly for the restaurant and the bars in our downtown area. So they do have to go through an approval process, and that has to go in partnership with the local municipality and the State Liquor Authority.
All right, thank you, Jason. Frank, with phase 3 opening, what is the gathering sizes that are allowed now? And what should we be keeping in mind as we go back to those gatherings?
So for inside seating, the restaurants are required to be at 50% capacity. So there will be a reduction, and they have to be able to set up with 6-foot separations. From a personal care perspective, those businesses that Jason listed off, like nail salons, tanning, and others, they have to maintain 6-foot separation. Those providing the personal care, like massage therapists, are required to wear a face shield, and as well as be tested, similar to barbers in phase 2. Barbers and hairstylists. So I think folks can expect to see things be a little bit different when they go to their normal the normal businesses they frequent. And I'd ask them to be patient, right? Because these businesses are in some instances working at half capacity, based off of the guidance that they've been given. So it might take a little longer. Be patient with them, wait, in a socially distanced manner. Likely their waiting rooms will be closed or significantly smaller. So it's going to be a different experience, and we just need to be patient with each other, including these businesses, as they get reopened and back to business.
Is there any recommendations on gathering sizes at this point? Or is it still 10 and under?
It's still the 10 and under. I think there's been situations like graduations and others that have been particular. Certainly churches have expanded to have in-person ceremonies now. So I think we're moving towards having those gatherings, but we need to move slowly. And I know we're asking for patience, and it's difficult because we want to be together. But those large gatherings are the place that we will spread the disease if somebody is sick and is in one of those. So let's keep moving forward, so we can get our businesses open. We can do the things that we love. Let's not to get together in large numbers that could potentially put us in a situation with large increase in cases.
All right. Frank, can you talk a little bit about testing data? How much testing is being done and who is getting tested as people return to work? Is there more going on as far as frequency of testing, or is that up to individuals and businesses?
Yeah, there's a lot in there, Amy. Testing has been evolving all the way through this, and it continues. Most recent changes, those individuals that have been out protesting were added to the criteria, so they are able to go get tested. The nursing home staff, which was a big driver of our testing numbers, as you maybe remember, they were required to get tested twice a week. That's now been reduced to once a week for any region that's in phase 2, and now we're in phase 3. So of course that's us. So those are our largest numbers that we were seeing. I think we'll start to see things even out as more folks get out into the community. I imagine that phase 3 workers will become part of the criteria relatively soon. And so it continues to evolve, and we encourage anyone that fits the criteria to go get tested.
All right, thank you, Frank. Jay, can you talk a little bit about employers' screenings, what they involve? The question is the screening just taking a temperature, or should they be asking whether they've had any changes in health or if they've been tested? So could you talk a little bit about a screening process?
Well, that seems like an easy question if you're looking at it just as that question. However, it's a little more complicated when you're looking at it within practice. I would encourage any private business that is opening to take a look at the guidance that New York Forward has put forward for their particular industry. Things are a little bit slightly different, but it's not just taking a temperature. It's also asking those 3 main questions. You know, have you had a recent onset of COVID-19 symptoms? Have you been in close contact with a COVID-19 positive patient? Or have you been subject to a local health department advisory where it may have been a chance for a community type spread? So that's kind of the bare minimum on what an employer should be asking their employee. Obviously, temperature checks are good, but as I mentioned before, they're only good if you're tracking that and making sure. And then as you're doing this, you may be creating that health record as well. So you got to be careful in how that's being used and how private that information and your employees' responses are. So you have to be aware of that as well.
And I know New York Forward has some good indications on how to do some of this and some recommendations, so people can also look there for some support on this one.
Correct.
Frank, back to you. Do you know what the status is of K-12 schools reopening for this fall?
No, I think there's a lot of work going on in preparation for that. There will be school in the fall in some form or fashion. I think we can say that. Whether it's in person, a hybrid, all remote, I think all of that is still being worked on. I know our local districts are working. They're also working together to try to coordinate. And they're also waiting for guidance from the state education department, as well as the Department of Health and the governor's office on how that's going to evolve. So we don't have answers now. What I am confident of is that our local districts are working tirelessly to figure out how to safely bring children, faculty, and staff back to school in the fall.
All right. Jason, are bars included in phase 3 restaurant rules?
They are, and they have to follow the same guidance, I believe, as restaurants. So again, to reference what Jay said earlier, New York Forward website, again, has been a good website with that guidance, but they are part of phase 3.
All right. And my final question, Jason, for you is phase 4 the final frontier, or is there another unnamed reopening phase after that?
Your guess is as good as mine, but right now we're good with 4 phases right now. You know, it's possible that if there is a capacity reductions that are in place, like what Frank said about restaurants now, that may carry on beyond phase 4. That's very possible. I know arts and culture and schools are part of that as well. So there could be not full 100% occupancies that may be that may go on beyond phase 4. But right now, as far as we know, there are no new industries or industries that are prolonged beyond the phase 4, at least that we're aware of. So I think that's good. We did have a Zoom meeting with the governor today, all the control rooms, and I'll add that he was persistent again on ensuring that we're monitoring the testing data and reassuring that our infection rate is some of the lowest in the country, if not the lowest, and the challenge that we've overcome over the past 100 days. Also remaining vigilant and remaining safe and smart as we go through the reopening process. And he referenced, and which is true, many of these states that have reopened or reopened before us have now started to see an uptick in cases, an uptick in hospitalizations. And we do not want to see that here in New York. So that's just a little bit of a thought process about the reopening. I think patience is going to be a virtue in this process. And we appreciate everyone who has followed and have participated. I think with that, Annie, I want to pass it back to you to close.
Well, Jason, you forgot the final phase. That's when that beard finally gets shaved off your chin.
All right. Very true. Very true. I think when either when we shut down the EOC or phase 4 is done, then we'll shave the beard. All right. Sounds like a deal. Annie, I'll pass it back to you to close it up for this evening.
Thank you, Jason. I was going to try to let my hair grow until you shaved your beard, but I thought you could win at that one. So in a week and a half, I will be getting this at least trimmed.
All right.
So I know sometimes folks go around and ask a question. Are we doing that, or just want me to close it up? Like on how everybody's handling things? And
we got no more questions, Annie. You can close it up.
Okay. All right. Well, I want to thank everybody here for answering everybody's questions and giving the updates. And thank you to everybody that sent in questions. And so we'll be doing this again next week on Thursday or Friday. Is that correct?
We think so. Well, we usually confirm on Monday.
Okay. Well, everybody stay safe out there and enjoy the sunshine. Thank you.
We off, buddy?
The stream is ended. You guys are good.